Hello and welcome to the Functionally Enlightened Podcast with Dr. Sharon Sarita. We interview well-respected medical and functional practitioners, as well as patients who have overcome disabling chronic conditions, such as dysautonomia, and reclaimed their health. These enlightened guests provide helpful tips on managing chronic pain and illnesses, using a combination of traditional and whole-body healing modalities. If you're interested in natural healing and quality of life improvement, you're in the right place. Thank you for listening to today's episode.
We're thrilled to welcome Dr. Bill Rawls to the Functionally Enlightened Podcast. As a leading expert in herbal medicine, Lyme disease, and cellular wellness, Dr. Rawls brings decades of experience helping individuals recover from chronic conditions like Lyme, mold toxicity, dysautonomia, which we all know well here, and co-infections. So his personal battle with Lyme disease led him to uncover natural solutions for restoring health at a cellular level, which he now shares openly through his books, his research, and his clinical experience. Today, we're really going to tackle some of the most pressing questions about Lyme treatment, herbal medicine, mold detox, optimizing cellular health. And so if you've been struggling with Lyme disease and chronic infections of any sort, even autonomic dysfunction, this is an episode you don't want to miss. So again, welcome, Dr. Rawls. We're so excited to dive into this topic with you.
Thank you. Thanks for having me.
Absolutely. So your personal battle with Lyme disease led you to explore herbal therapies. Can you share how this experience kind of influenced your approach to treating chronic illness, and definitely share with us what your battle was really all about?
Yeah, I've told this story plenty of times, and it's it is now 20 years ago. So I've been healthy for 15 plus years, pretty robust health, some of the best health that I've experienced in my life. But it was a life-changing experience for sure. I started my career 40 years ago. I graduated from medical school, went on and specialized in obstetrics and gynecology, really because it dealt with healthy people bringing life into the world, interventions that really made a difference in people's lives, as opposed to managing chronic illnesses with medications. But in that period in time, it required a heavy burden of call in the hospital. So every second to third day, along with working in the office, I was having to cover labor and delivery and the emergency room every second to third day, every second to third weekend, which meant most nights when I was on call, I got maybe 4 hours of sleep if I was lucky. And when I was in my 30s, I could do that just fine. But as I was getting to my latter 40s, I lost the ability to recover when I wasn't on call, and I lost the ability to sleep. But more than that, my whole body started breaking down. And eventually I stopped taking obstetrics call. I started a primary care practice just so I didn't have to have that kind of obligation. But things kept getting worse. My sleep didn't come back, even not having to take call. And absolutely everything started breaking down. I started having heart issues, brain fog, symptoms that you would relate to multiple sclerosis. And, that long list of symptoms that anybody that identifies with fibromyalgia or really any chronic illness have. No answers. I went to specialist after specialist, no answers. Lots of borderline tests, but nothing that really solved the problem. Initially, the Lyme test was negative. I kept thinking, this has to be something like a microbe going wrong in my system. But I hadn't really had any tick bites at that time. I had a lot of tick bites when I was a kid, but didn't remember getting sick around the time of the tick bite. Later learned more about this thing we call chronic Lyme disease and realized that people can have those microbes and those bacteria in their system for a long time before they become ill. In fact, that's more typical than not. And finally got a test and thought, this is the answer. I can take antibiotics and I'll get well. That didn't happen. It made me worse instead of better. And at that point in time, I really didn't have a lot of resources to pursue therapy with Lyme doctors like IV antibiotics and a lot of other things, or the desire, or, looking at the evidence, just couldn't find a lot of evidence that people were getting well. About that time, an herbalist named Stephen Booner had written a book defining this herbal protocol for chronic Lyme, had some good science behind it, researched the herbs, and I felt like there was a high safety profile. It wasn't expensive. So I embraced it, and over a 5-year period, got my health back completely. So for the past 20 years, I've really been immersed in understanding what was going on, why the herbs worked, and how that influences really every other risk of chronic illnesses. Because you look at it, you find evidence of Borrelia in multiple sclerosis, cancers, all Parkinson's, dementias. But this thing we call chronic Lyme has now been associated with this wide spectrum of things we call co-infections. And when you start looking up the connections between those things and chronic illness, all the lines between chronic Lyme and all the different chronic illnesses start to blur.
Right. Right. And when you mentioned that you had probably had tick bites as a child, but how many years were we talking before the symptoms started to manifest?
Oh, yeah. I'd say 10 or 20 years.
Yeah. I've had a similar situation. And when you also discuss chronic illness and just things being reactivated in the body, I know as a child I did have a tick embedded in my head for about a week before they actually found out what it was.
Yep.
No real sickness ensued. Like I just was a normal child for many years. Fast forward, I guess I'll age myself here, 30 years or so. I had a hernia repair surgery and my body just shut down. So I know that I had a foreign body reaction to the mesh itself, but I'm thinking of all of these other things, the cofactors that were happening in my body, including Lyme disease, where I had tested with conventional labs and it showed up negative. And later on, I tested, as I'm going through my own healing journey, I tested with the Vibrant Wellness panels. And they did see some indication of Borrelia and the other co-infections, and even like a small, not CDC, something that the CDC would categorize as an active Lyme infection, but enough of something that I wanted to treat myself. So do you see that happening pretty routinely, some cases like that?
That's virtually every case of chronic Lyme, but that's virtually every case of autoimmune and multiple sclerosis and fibromyalgia and chronic fatigue. Again, the margins start to blur when you really start going deep into this thing. I did a search on ChatGPT the other day just for kicks to see what it knew about co-infections associated with Lyme disease. It came up with 50 different microbes.
Yeah.
That's a small list. My list is well over 100, and I think that's scratching the surface. So what it boils down to is there are a lot of things that we can pick up and do pick up that can become quiescent, dormant within our system, within our cells through our lifetimes. So it's not just Borrelia, it's Bartonella, Babesia, Mycoplasma, Epstein-Barr, Parvovirus, and the list just goes on and on and on. And these things can quietly reside inside different cells in our body. And, the evidence that this actually is happening is becoming very, very strong. Every year that goes by, we find more and more evidence of it. And it's hard to absolutely define it because, what you want to know is what's the incidence of this in healthy people? And if these things are quiet or dormant inside cells of the body, you don't have a positive test, even though you may be harboring that particular microbe. It's not until it becomes active and really significantly active that you start to be able to find it. So the only way to find it is chop people up and look in their tissues, and we just don't do that routinely with healthy people, of course. So it's taken a long time to accumulate the evidence, but I've been looking at the bits of evidence for 20 years and compiling it, And it's just that argument, that possibility is getting stronger and stronger and stronger. And it really starts to explain not one chronic illness like chronic Lyme, it starts to explain everything.
Mm-hmm. Yeah. So I know in your treatment guide, you emphasize the role of herbal therapy for managing these chronic conditions. And, I did look into some of the information you provided on Lyme disease itself, but thinking of our audience, we all have, like you said, a myriad of chronic conditions, and there's not really any insight or any specific protocol to tell us what to do first.
Right.
So in your expertise, first off, we'll start with how are there specific herbs that you find most effective, and how do they contribute to overall recovery?
Right. There are herbs that I like and that I've used for years that have a lot of evidence surrounding them for what I'm looking for. But I would say that, when you look at the body of herbs worldwide, there's a lot of stuff out there that can help us that we should be taking advantage of. And it's really about perspective on how you look at herbs and herbal medicine. So I think a lot of people look at herbs as being maybe just weak versions of drugs. And they're looking for herbs to do the same thing that drugs do, but with less side effects. And what I would say right up front is it's like comparing apples to oranges. They're just not anywhere the same. But there is some similarities in that both oranges and apples are fruit, right? So when you look at that thing called herbs, we're talking about plants, and aside from that, medicinal mushrooms.
Mm-hmm.
And that ranges everything from culinary herbs and plants that you would eat in your food, all the way out to herbs with very strong drug-like properties, and many of which some of those chemicals have been pulled to make drugs. I don't typically go down to that end of the spectrum. I'm looking for herbs that don't have drug-like properties at all. That I'm looking for them for their ability to promote healing in the body, which we can talk about in a little bit more depth. But so 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 I think getting away from looking for herbs that might have drug-like properties takes you to a better place of how you're going to get the best use out of the herb. So what we're getting from an herb when we take a plant, or secondary to that, a medicinal mushroom, we're basically borrowing the plant's system of protecting itself, and more specifically, protecting its cells. So plants are producing a wide spectrum of chemicals to fend off pathogenic bacteria, viruses, protozoa, yeast, free radicals, toxic substances, radiation. It's trying to neutralize all of those things to protect the cells that make up the plant. So when we take those things, we're getting all those protective properties. So we're also getting some of the regulatory properties. So a plant is a multicellular organism, and it has to change its cellular functions. Like, when the seasons change or the weather changes, it's dry or it's too wet, then it uses chemical messengers to synchronize cellular functions. Well, we actually use a lot of those same chemical messengers. You find a lot of our hormones in plants and other organisms. So we're getting that. So some of those substances do have drug-like effects. They cause us to be stimulated, like caffeine is one of those chemicals. Or some things that act like are endorphins. They have narcotic properties. So those are some of the more drug-like effects. Again, I'm trying to stay away from that. I'm looking for plants that mainly have protective properties, and that includes a wide spectrum of antimicrobial properties.
Mm-hmm.
But the interesting thing is you're talking about a system, hundreds of chemicals, not one chemical like an antibiotic. So the antimicrobial properties of a plant are selective for pathogens, but don't disrupt our normal flora. So that's how I could get away with taking high doses of herbs for, half a decade and actually made my flora and my gut better instead of worse. And that's been documented by science that herbs suppress pathogens without affecting our normal flora.
Mhm.
Well, that's exactly what we want for any kind of situation.
Right, right. And the synergistic effects, like you said, it's multifaceted and it affects system-wide. So it's a holistic look at healing. With that being said, I know going back to, well, you've been taking long-term herbs and I'm sure with your patients, you might prescribe for them. But is there some negative association with long-term use? Is it herbs should be cycled or like just cyclically, quarterly? How often should people change out herbs that they're using?
I had those same kind of biases that came from my medical training, and that held me back in my recovery, that I would look at it as this is therapy, and it potentially has toxicity, so that I need to, as soon as my symptoms are improving, I need to stop. And I would get to about 70, 80% better, and I'd stop. And then stress would come along and I'd be right flat back on my face again.
Mm.
And I kept doing that over and over. And I finally just looked at it and said, with these herbs, I feel better. I haven't experienced any toxic effects. My gut is better than it's ever been. I'm going to just keep taking them. And it was that transition that carried me to a state of complete wellness. But what's more significant is I've been taking herbs now for 20 years straight, every day, every day. Now, I don't take the volumes that I did during my recovery, but I take them every day. And I've experienced some of the highest level of health that I've experienced in my entire life. A lot of symptoms, gut dysfunction, arthritis, so many things that I was having even before I defined myself as having chronic Lyme disease are gone. Not to say I'm not aging. I'm definitely aging, but I'm aging without the kind of symptoms that most people have
Mm.
at age 67,
Mm.
which has really been pretty remarkable. So when you really get around to studying the effects of herbs, these things that we call adaptogens or antimicrobial herbs, as opposed to things that have stronger drug-like effects. So it's when you get into drug-like effects, when things are actually affecting chemical pathways, receptors, et cetera, inside your body, that's when you have to start treating them like a drug. But that's, those kinds of herbs aren't really widely used in a lot of modern herbology. Most people are using things that are pretty darn safe to take long term.
Mhm.
And I think about it this way too. If you look at our ancient past, for hundreds of thousands of years, humans were foragers. We ate a forage food diet that best that we can figure with fossil records of various kinds. Um, Most humans on Earth ate about two-thirds plant matter and about one-third animal matter. And the plants they were eating were stems and roots and leaves and wild berries and things that we would define as being herbs. And so they were taking large volumes of that because you had to eat a lot of it to get enough carbohydrate to actually survive. Pre-seed diet, there wasn't much carbohydrate in food, so people ate a lot of plant matter. So they were getting tons of this stuff every day their whole lives. So it's almost like we've given up that really important thing. So I think one of the biggest deficiencies in our diet is that phytochemistry of plants. We're not getting it. But even when we started farming and started eating more grains and beans, we still kept our culinary herbs that we used every day and our medicinal herbs that people use continually too. We gave all that up and traded it in for drugs about 100 years ago, and we haven't been as healthy since.
Mm. So we can talk about some of the herbs that people are probably exposed to, but they don't know the medicinal purposes of it. So say we're talking about oregano, and then the adaptogens that are marketed, people aren't really sure why they're taking it, but you have maca and ashwagandha,
Yeah.
rhodiola. Maybe you can tell our audience a little bit about some of these herbs.
All of them are really nice. The things that we define as adaptogens are herbs that specifically have a low potential for toxicity. And what they do is they block various stress factors, chemical, microbe, and other. They normalize our stress hormones. So, yes, they are very beneficial. Now, quite frankly, a lot of what people are taking have a low concentration of the actual chemistry of the plant or mushroom in them. It's mainly fiber in the preparations that people are taking. But even so, you're getting still some benefit. So and you look what these things are doing are protecting our cells, and that's really where I am in my understanding of health and opposite of that illness is our body is made of cells. Everything that happens in our body is a function of cells, whether that's our heart beating, brain impulses being fired, thyroid hormone being produced, doesn't matter. It's all done by cells. All aspects of all chronic illnesses or all illnesses, be that symptoms, abnormal labs, inflammation, hormone imbalances, every single bit of it is rooted to cellular dysfunction.
Mm-hmm.
What healing is, though, the very definition of healing is the ability of our cells to recover from stress and regenerate. So, if you're taking a substance that's protecting your cells from free radicals, from microbes, from radiation, from all kinds of other stress factors, you're actually cultivating an environment that cells can recover. We're basically promoting healing with these herbs. So it's very, very different than drugs. There are no drugs that I know of that actually promote healing.
Mm-hmm.
What drugs do is block manifestations of illness. And sometimes that can be valuable for stabilizing illness and preventing something bad from happening, but it doesn't get to the root causes of the actual problem that's driving the cellular dysfunction. So drugs are basically artificially blocking cellular dysfunction, but they're not getting to the root causes of what's stressing those cells and causing that dysfunction, so people don't get well.
Right.
Yeah.
Yeah, that makes sense too. And they're managing symptoms, so they may be focusing on that. It's one primary symptom. Maybe it's tachycardia, or maybe it's the chronic pain. So we're blocking some of those receptors. But as you mentioned, we're not addressing the root cause. So that kind of takes me back, and it might not be a root cause because now we see system-wide the body's in metabolic chaos. There's multiple systems that have been affected, and so I'll mention in my practice as a functional diagnostic nutrition practitioner, we use a set of labs to kind of identify all of those imbalances in the body. And adrenal support is something that we do look to often because we see the cortisol response is either, like most of the clients that I see actually have almost a flat line in the cortisol response. So we know that they've been under adrenal stress for so long that they no longer have the output. And so for that particular group of clients, we'll say primarily those that are having autonomic nervous system dysfunction, would you have any recommendations on where they could begin in terms of knowing that they have a lower cortisol response?
Yeah, I went through about a 10-year period that my practice gravitated from primary care to what would be defined as a functional medicine practice. And as I moved through that, I realized that the more I talked to people, the fewer labs that I needed. And I got to the point that I don't use all that many labs anymore in my practice because there's so many things that the body is telling us. And if we reason through those things, we can figure them out.
Mm-hmm.
And it really gets down to this concept of cellular stress. So looking at our cells, when we have an illness, our cells are stressed by definition. Illness, chronic illness is cellular stress and the dysfunction that results from that. So when you start looking for the factors that drive cellular distress, it's really pretty finite. And this is basically getting to, the fundamental cause of chronic illness. So every cell in the body is like a little microscopic biological machine. So every cell is independent. So if you think of them as little microscopic machines, they have specific operating requirements. So every cell in the body needs the right nutrients. So if you're eating a whole food diet, you got that. It's giving all of the different cells in your body the different nutrients they need. They need a clean environment, and that includes all the environmental toxins that we're exposed to, plus natural things like mycotoxins. They basically damage or inhibit cellular functions or act like hormones. Our cells need downtime to sleep. We need 8 hours of sleep for our cells to recover. If they don't get that, you start your next day with a deficit. Our cells need really good blood flow, and that comes from being physically active. That's the main thing with exercise. And the fifth is this idea that we have this ecosystem of microbes, not just in our gut and on our skin, but low-grade presence of microbes that can be dormant inside our cells, waiting for those cells to be stressed and reactivate. So when we look at chronic illness, they're usually precipitating factors. You look for the why in chronic illness. What testing tells us is how we're ill. It doesn't tell us why we're ill, how those factors came together to cause that dysfunction. So that's where you have to do that detective work and talk to the patient and figure out, well, how did that come together? So when I talk to someone, it's usually through a period of time. A lot of times I even start back at their birth, looking for how these factors, these cellular distress factors, came into their lives. But once that's precipitated, this ongoing cellular stress, often as a perfect storm of not just one thing, years of eating a bad diet, not sleeping, in my case, like sleeping 4 to 6 hours every night for 20 years, pushing that stress button over and over, often people sitting in front of a computer, not getting exercise, and environmental toxins. 10 years of the time that I was struggling to get well, or during the time, I actually ended up in a moldy office building. I actually recovered in that building, though. I rebuilt my body despite the presence of the mold.
No mitigation in the building itself?
I ran ozone in the weekends. I cut it down as much as I could, but I was able to regain my health despite those factors. So it's a message that sometimes you just have to make do with what you've got and work around it. And I think the herbs were a really big factor in that. But all these things come together, and that allows activation of microbes, and the microbes start breaking down our cells. And our body starts attacking the microbes where they're emerging from, which really starts to explain autoimmunity. And our whole body becomes this state of these reactivated microbes, basically making our tissues into a food supply. And that's what chronic illness is. So if you look at it that way, all those cells are sending distress signals to the brain all at one time. And that activates that fight or flight response. So that starts in the brain. It works through the hypothalamus, the pituitary, and then the adrenals. So it's pumping out these alert signals to push our cells harder and harder, both metabolically with our thyroid, but also through our adrenals with cortisol. And that high alert keeps our cortisol levels higher. And after a while, though, so people are either in a state of this not being able to sleep, driven high sympathetic overactivity that drives dysautonomia and everything else, or they're beyond that, that the adrenal cells themselves start to get burned out and they just can't produce the cortisol anymore. And then people collapse and they're sleeping 10 or 20, 10 or 15 hours a day and they're not rested. But the good news of that is the cells aren't gone. So the difference in Addison's disease, where something has come along, usually an autoimmune reaction, probably to microbes, has killed adrenal cells, so you don't have enough adrenal cells, and you actually have to take cortisol for or cortisone the rest of your life. Where adrenal fatigue is just the cells are tired. And if you cut that sympathetic overactivity, and one way to do that is with adaptogens like ashwagandha and calming herbs like philodendron and magnolia from Chinese medicine. And you calm that sympathetic overactivity, and then those adrenal cells start to recover. And in that in between time, a little licorice can actually help boost their functions a little bit and compensate for them. So it's really working through those things that are happening at the cellular level through the body. And you start to be able to figure out this is why this person is sick. And here's how we need to approach getting them well.
So you mentioned licorice root there for that would be more for the exhaustive state, and then there's contraindications there as well. Do you have anything to say about who should avoid these particular herbs?
Yeah, licorice is one of the few that I don't recommend that often. Even somebody with adrenal fatigue, unless it is severe, I typically use just other adaptogens, like ashwagandha is usually one kind of central to what I use, but also the mushroom adaptogens like cordyceps and reishi I think are really important because they have immune modulating and antimicrobial properties. They really come into play and they're extremely valuable there. Licorice, though, is stimulating, and I'm a high sympathetic activity guy, even in a calm state. My brain is working all the time. So I just can't take licorice. I can't even take DGL, which is what you use for your gut, which has the glycyrrhizin taken out of it. Still stimulates me. So I think you have to be careful about some herbs. And on all of my protocols, that's something that I've just been so remarkably careful of, is to choose herbs that aren't stimulating, because everybody that's chronically ill has this sympathetic overdrive going on. So a lot of really great herbs that you hear about, like Siberian ginseng, Eleuthera, or Asian or American ginseng, they're both very stimulating. I never use those. And I'm also careful about, what I found out there in the industry that it's really common is companies will do formulas that they'll put stimulating herbs in the formula so that people feel an effect. And it's so everybody expects, well, if I'm taking a medicine, I'm going to feel the effect of it. And then when they take all these adaptogens and things that I use, they don't feel anything until they've been taking it like a month or two. And then maybe they stop taking it and it's like, oh, yeah, I felt a whole lot better when I was doing that. But I really try to avoid herbs that have stimulating properties in people that are struggling to recover from any kind of chronic illness, because it is just so critical that they get sleep.
Right. And especially I was thinking that particular case is when someone's suffering with insomnia and I've seen this many times, they're taking this like a compilation of herbs, and it was recommended by not even a practitioner. Maybe they saw it on social media or a friend. And so things like licorice root were what I was noticing in these things. They're telling me that they're experiencing nightmares and broken sleep that's worse than they've ever had. And so they kind of shy away from any herbal remedies, and then they return to pharmaceuticals. So how would you address that? And do you have a preference for single herbs versus the combination therapies?
I I have been formulating products for, I guess, 15 plus years, and I'm really careful about what I put into it. You do get a synergy of using multiple herbs together
Mm-hmm.
that is really nice. The analogy that I've used is a symphony. Like if you went to hear a symphony and there was one violin and that was it would sound nice and you would enjoy it. But say there was a whole string section, and then you add in the brass and the wind instruments and percussion, and you have all of these things playing together. Then you've got something that gives you goosebumps. Same kind of thing with herbs. You get a synergy. Now, you don't get that with drugs because what happens when you combine multiple drugs, you synergize the side effects and the negative effects. Whereas with herbs, when we're using the classes of herbs that I'm talking about, you synergize the benefits and you get a lot more from them. But you do have to be careful, and something that I've been seeing more frequently in products that are created for chronic Lyme disease. And herbal therapy is appearing to be rising to the top as the best solution that someone could make. But so a lot of companies are entering that space. And what I'm finding is people expect to have a Hertzheimer reaction when they
Yeah.
take something to feel like, wow, this is working for me. And herbs that work, a lot of people do have some degree of that, but I've started seeing herbal formulas that have herbs that I would even define as being mildly poisonous in them. And at first it was like, why are they putting that in there? But then I realized it's causing the same kind of reaction that they would have with a Hertzheimer, so they feel like it's working.
Hmm.
So, yeah, you do have to have a bit of caution and really understand, have some trust in the company that you're buying it from and the track record they have and how long they've been doing that and what kind of other, bandwidth they have as far as promoting programs and do they have that core of they've been there a long time, they're a trusted company, a lot of people are using that particular company. Then you start to get more comfortable with the products.
Mm-hmm. Now, Dr. Rawls, you did mention the Herxheimer reaction, and in our audience or our population, we do see more of the hesitation to take on additional, if it's more than one single ingredient, they have that hesitation because they're fearing that Herxheimer reaction. What kind of reactions can they expect from, let's take a reputable source where you have a product that's been vetted? What can they expect?
It is highly variable from person to person, and when we define the Hertzheimer reaction specifically as die-off of bacteria that causes an intense immune reaction, but I think here we're talking about something that is quite a bit different from that. Classic Herxheimer occurs in a situation, often in an acute infection where there's a high bacterial load and you have a lot of kill off. But when you're looking at chronic situations, you're talking about bacteria and other microbes that have been buried inside cells and they're reactivating, and a lot of those cells are compromised. So not only are you killing microbes, you're killing defective cells. That creates a lot of debris and congestion in tissues. So the dead cells and debris also are causing immune reaction, and they're clogging up those spaces in between cells that cells have to use to purge toxic substances and get nutrients and oxygen. So they're basically, our cells are choking. And so it's we've found that stepping into the whole thing, in fact, I'm launching a new program this year, looking at solving this problem in phases. So starting with that idea that, everybody's body is in turmoil. And a lot of that is driving that sympathetic overactivity that is causing have people to have poor sleep, poor digestive function, accentuating allergic reactions. They've got a lot going on. So we feel like using herbs and brain retraining and various kinds of things to calm that sympathetic overactivity, and then step into the antimicrobial herbs very, very slowly. And over a 6 month period, a couple of months to solve that, and then move into restoring gut function, addressing food sensitivities, and detoxification at that point. Really optimizing that, and then finally that really getting to the herbs over time that are going to be stronger, that are going to keep those microbes suppressed, but at the same time, working toward cellular recovery to optimize healing. So I think it's a 6 month journey to get the average person through that whole process with best results at the other end.
So you discussed the importance of the cellular wellness, and that's a critical piece of overcoming the chronic condition. So I guess, can you elaborate a little bit more on how we focus on that cellular health and how we can help recovery from various conditions, whether they be dysautonomia or what we see often is people experiencing implant illnesses?
Yeah, well, it all gets back to those 5 factors. Diet, clearing up food sensitivities is part of it, or identifying it. So we're addressing those issues. 75% of the foods I ate, I was sensitive to because I had bad leaky gut. So you have to address those issues, but moving people from probably where they are, and most people in America aren't eating a healthy diet, to something that's reasonable. And my qualifications for a healthy diet are eat whole foods as much as you can. 90% of your food should be whole food sources. I try to finish every day having eaten more vegetables than anything else. And then I divide my foods up pretty evenly for what works for me, because I still have some sensitivities from the foods from way back. And I try to keep my total carbohydrate count below 150, which is not ketogenic. I don't think you necessarily have to be ketogenic to be healthy, but it keeps me from eating flour products and sugar and other kinds of things. But it allows me to eat fruit and some things that wouldn't be allowed on a ketogenic diet that I think actually do provide a lot of health benefits. And then intermittent fasting, trying to narrow that eating window, preferably to 16 hours of not eating, which leaves you 8 hours to eat. That's not so bad. And then adding in some fermented foods, preferably fermented vegetables like kimchi and things like that. If people are doing that, they're doing great. And then the second thing is the environment. And there are a lot of environmental factors that we're exposed to. You mentioned implants, and that so there's a wide range of not only things that we're getting in our food, water, and air, but things that enter our body for various different reasons that we may or may not react to. Tooth implants, there are a wide range of different ways that foreign substances can get in our body and affect our total cellular health, which affects our immune health and everything else. Sleep, average America, 6.5 hours. That's not enough. What it means is that if you get 6.5 hours of sleep, your cells haven't recovered from the day before. So you start your morning with a deficit, and 2 cups of coffee isn't going to be enough to get you where you need to be. That's actually just going to push your cells harder, so you're going to be worse the next day. Exercise. We talk about exercise, but it's not as necessarily going to the gym and lifting heavy weights. It's moderate activity through the day that moves blood, and that clears those spaces between our cells. It allows our cells to breathe. It helps our cells purge toxins. And then that final factor is the herbs to protect your cells we're all exposed to more microbes than we ever have been, right?
Mhm.
When I was born, there were 3 billion people on the planet. Most of them didn't drive cars.
Mm.
Now there are 8 billion. Most of them are driving cars, and all that pollution is going into the environment, but they're also taking airplanes. Look overhead. You will not see a sky that doesn't have contrails in it from planes going over. So not only are there a lot more people, there are a lot more people circulating everywhere, and we're spreading a lot of new microbes.
Mhm.
And we really need to be more vigilant about that. Some of our best protection may be the extra protection that we can get from herbs, which not only have antibacterial properties, but wide spectrum antiviral
Right.
properties. So they protect us from a lot of things. But it's that ecosystem that we may have things in our cells and our tissues that are actually beneficial. So as far as what's good and what's bad, we haven't completely defined those things. But it is apparent that herbs can help us balance that greater microbiome that extends into our tissues.
And Dr. Rawls, I really appreciate the fact that you bring in this functional perspective. It's really in line with what we need to focus on, the pillars of health, the diet, the rest, the exercise, the stress reduction, and then the supplementation, the targeted therapies, which you bring in with the herbs. We also do that, and we bring in binders because of just the amount of toxicity we're exposed to all the time. And you mentioned we have this die-off taking place in our body, whether it's, even if you're taking pharmaceuticals, antibiotics, you have die-off, but also herbs and other therapies. I'm thinking just specifically for some Lyme protocols that I've seen, barberry, garlic, what are seen like biocide and botanicals, different herb mixtures there. But what I've seen is that the sensitive population needs a little additional support to get their body to excrete all of this. Have you seen that, and how would you approach it?
Yeah, our cells will take care of themselves and recover. So it's creating that internal environment that promotes cellular health. And that concept of detoxification starts at the cellular level. We're toxic because things are absorbed into our body that are absorbed into our cells. And we're exposed to more toxic chemicals than humans have ever been exposed to. Many of these chemicals are organic, so we absorb them. They get into our system. And when they get to our cells, they're not natural organic chemicals anymore. So they actually basically just get stuck inside our cells and inhibit function. It's kind of like throwing sand in our cells. But our cells are constantly purging those things. And where they purge them is into that very, very narrow space between cells. Our cells are all stacked together pretty tightly. So our blood, when it is leaking plasma into that space, carrying oxygen and nutrients, and it's picking up carbon dioxide, but it's also either picking up and removing through the bloodstream these toxic substances and metabolic waste that our cells are trying to purge, but it's also pushing them into the lymph system so they can be passed along and through, ultimately to be dumped back into the bloodstream and finally to the liver. But that process starts around our cells. So again, moving blood is so remarkably important. So for people that can't exercise because of inflammation, I strongly recommend sauna, really of any variety. The easiest is infrared sauna. And basically what we're doing is we're heating up the body, we're moving blood, and we're flushing those spaces. So once you flush that space, everything goes to the liver. And all those toxic substances are neutralized in the liver. Well, 25% of the population has fatty liver. So as you grow older, your liver cells are replaced with fat cells because you burn out your liver cells. Is interesting. When I used to do laparoscopies, I would always look around the abdomen and look at people's liver, and a 20-year-old would have this nice, beefy, red, healthy looking liver, and a person 50 or above would have like a mottled yellow liver, representing that they've had so much of their fat cells. So if you don't have good liver function, you're not going to be able to process those toxins that are mobilized. So one of the things that so many of our herbs, many of the herbs that we used in Lyme, like Japanese knotweed, reishi, andrographis, are really good liver protectants. But I've been taking milk thistle for 15 years. And milk thistle has strong protective properties, along with many other herbs. That's another cool thing about the herbs is they actually protect cells, including our liver cells. So milk thistle has been found to actually cause regeneration of liver cells. One of the reasons our cholesterol goes up as we age is because we lose liver cells. Our liver cells are responsible for managing cholesterol. And as we have fewer liver cells, we can't manage it as well, and those levels start going up. I've been taking milk thistle for 15 years, and my cholesterol is actually better than when I was in my 40s.
Hmm. Yeah,
Yeah.
yeah. It's funny you bring that up because a lot of the people that I work with, they've been on a ketogenic or carnivore style diet. And so they see the lipid panels coming back slightly abnormal, but nothing too drastic until, if they're on this type of diet for an extended amount of time, it's really linked to the liver health, not so much the dietary intake. And I do see that with herbal use. Now, I'm not the one working with them directly on the herbal, but they're taking things like Livitone and, again, Biomatrix products that are an assortment of herbs. They haven't made modifications to their diet. They're still whole foods, clean foods, organic, grass-fed, but they see the lipid panel returning to normal. So I'm glad that you brought that up.
Yeah, it's really important. And then finally, after the toxic substances are neutralized, they end up in the GI tract, but they don't flood the GI tract. It's a gradual trickle. So you need something to bind them continually every day that's not going to slow motility down. And the absolute best binder on earth, is vegetable fiber. Vegetable and fruit fiber. Eating vegetables every single day is the best binder that you can do because it's constantly binding, but it's also increasing intestinal motility to get that stuff out of your body. So that's how I think about detoxification as far as breaking it down to what's really important.
Yeah, that sounds great. And I love that it focuses on, again, things that are accessible to most people. And so I guess to be respectful of your time, I want to ask, is there anything else that you would want to get out to our general audience who is suffering and maybe hasn't gotten the knowledge or the resources they need to learn about this herbal type of treatment protocol?
Well, yeah, I do a lot of education. I've written several books. My latest book, The Cellular Wellness Solution, goes into detail in that cellular model and talks about the spectrum of microbes and how that all works. But also it's a primer on herbal medicine. So it gives people a foundation to start using herbs comfortably. Talks about herbal preparations and how they can safely use herbs, which herbs they might want to choose for different purposes. So it's got a lot of good information like that. So that's a good starting point. But it always comes back to your cellular health. Your body is made of cells. And if you're not focusing on your cellular health, what's happening at the cellular level, and the things if you're not creating that environment to promote cellular recovery, then you're not going to reach the wellness goals that you want to.
Right. And how can people reach you and get a hold of your book?
The book's available on Amazon, and I have a company called vitalplan.com that folks can find information. We have herbal protocols, but also a lot of different kinds of support and programs and that sort of thing.
Okay. And you mentioned launching a new program soon.
It's called Restore 180. Yeah, we're pretty excited about it. It's really a product of my 20-year journey and everything that I've learned along the way. And it's interesting. I don't define it really as a course as much as an experience of immersing yourself into that environment.
Okay. Love it. Love it. So again, thank you so much for joining us today. This
Oh,
wraps up
pleasure.
today's episode. We truly appreciate everything, you taking the time out to share all of the invaluable insights and talk to us a little bit about the herbal therapies, how we can mitigate those chronic infections, even mold. So, and specifically the importance of cellular wellness. So that is something that I hope our audience will take home. Your expertise and your journey were very inspiring, and I know our listeners have gained so much wisdom from you.
Well, thank you so much for having me. It was a pleasure.
Of course. To our amazing listeners, thank you again for joining us. If you found this episode helpful, you can feel free to drop comments or your questions because we'd love to hear from you and continue the conversation. So make sure to subscribe to our podcast so you don't miss any episodes in the future. All right. Thank you, everyone, again. Stay curious, stay empowered, and see you on the next episode.